you know how to effectively communicate with your workers, because during this Delta time and during this very changing virus and this pandemic, we need to effectively communicate with our employees. Communication is key, goodness gracious, for everything, right? In every single relationship that you deal with. But specifically, employer employee relationship with this COVID thing, it's key that you learn how to communicate effectively, because the regulations should be changing as fast as the COVID and as the pandemic is changing, but they're not. And that's because of the little manpower that OSHA has, the little manpower that many of you have, because we're seeing that most employers are having difficulty retaining people or even employing people because so many people are under unemployment. Anyways, formulating a preliminary cheat sheet to aid employers to communicate with employees during the surge of COVID-19 cases and the Delta variant. Apparently, some of these high numbers in hospitalizations are starting to see at least a steady line where we're not having very high numbers climb up and up uh, as the days go by. So we did see a large surge. We saw a lot of hospitalizations in the last month. But for the past week, although we continue to have maybe an 80% occupancy in our hospitals and ICUs, we are not seeing new hospitalizations in the big numbers that we were seeing a few weeks ago. So we have to have a cheat sheet so that we learn to communicate during this COVID Delta variant surge, discuss testing protocols that are different from the current Cal OSHA requirements, how to continue improving your written policy. So I want to point out some of the components of your current policy and how they don't jive with the Delta variant and what's happening right now and with what the CDC is recommending, because it's just really not jiving. But what I want to make sure you guys know is that I've always told every one of my clients and in these webinars the importance of taking a look at guidance that is out there available to you through the California Department of Public Health, through your local health department, and through any of your local or your county guidance that it is out there. So for us here in California, we have covid.ca.gov, we have the CDH, the California Department of Public Health website, and we have the CDC, right? Most of those are a little bit more strict right now during the Delta variant circulating in the United States. So we have to follow that, because what's happening is Cal OSHA released those updates in June 17, and it really is up to us to continue staying up to date and modifying our policy accordingly. So although it is not passed as law, we're going to see some of the things that you should be doing that are outside what the regulation requires. So some of the terms that are not mentioned in this regulation are terms such as, contact tracing, the Delta variant, or any of those variants of concern, variants of interest. Those are terms that are not found in a regulation, but they are there in regards to what the requirement is. So for example, contact tracing is following up with who was in close contact with that person that's a positive case, right? Contact tracing has been done historically, used for decades by your state and local health departments, and it's supposed to slow down the spread, right? So you have to let people know that they may have been exposed to COVID-19 cases, and they have to monitor their symptoms and health signs. Uh, Contact tracing helps people that may be exposed to a COVID-19 case to get tested, so to get testing right away so that you're able to slow the spread, right? By quarantining those people, but making sure you don't get them back to work when you shouldn't, and asking people to self-isolate, right? So although this is not a term that is in the regulation, these are things that you do required in the regulation, because someone was asking me, how come we don't do contact tracing? Well, you are doing it. It's just that the regulation doesn't call it contact tracing. They are actually separating the requirements as you go through your entire coronavirus prevention program. The guidance for fully vaccinated individuals is not updated in the regulation. The emergency temporary standard released in June 17 was taking in account vaccination issues. They said, you know what? Now that people are fully vaccinated, we don't have to exclude them from work. So even if they were a close contact, or when you make a list of those people that are identified as close contacts, you don't have to send them to be quarantined or be home. So don't exclude them from work because they were vaccinated. This is one of the things that are different now. What we say here is if you've had close contact with someone who has COVID-19, you should get tested 3 to 5 days after your exposure, even if you do not have symptoms. Where did I get this from? The CDC. The Centers for Disease Control are saying, you know what, get tested. The emergency temporary standard says don't exclude them and don't test them, right? What do we say under the CDC guidance? Well, you don't have to exclude them, but you should test them, right? Now, in regards to you don't have to exclude them, I recommend my clients to exclude these workers until they get tested. See, that's not part of the regulation right now, but it is part of the CDC recommendations and guidance. So if they're supposed to get tested 3 to 5 days after their exposure, send them home until they have their test and it is negative, please. So let's follow this guidance. And also, they should wear a mask indoors in public for 14 days following exposure or until the test result is negative. So I would, since you're sending them home till they get a test, just follow this. And it also says you should isolate for 10 days if your test result is positive. I should also give them this information because just for the purposes of protecting their family, they should know, that it's better if they wear a mask indoors or in public until they get the result, because you're sending them home for 3 to 5 days. So they should follow this guidance as well. The Delta variants in your business. Well, the Delta variant continues to reduce a person's risk to contract the virus that causes COVID-19, including this variant. So the vaccines are the most important thing that we have right now to combat this thing. Vaccines are highly effective against severe illness, but the Delta variant causes more infectious and spreads faster. So these are the issues that I'm having right now with my clients. I've seen this with 2 different clients. If they have small crews, workforces that, because of this whole opening of the economy and vaccination issues, they got more relaxed and they're allowing for, during breaks, they get together, they talk, or they're having some sort of socialization or activities like get-togethers. So get-togethers are your enemy right now during the Delta variant circulating in the US. It's so highly contagious that it's very easy for you to have an outbreak in your hands. Remember, an outbreak is 3 people within a 14-day period. So I had the issue with a company that one of my clients, and they held a celebration. It was a small gathering because it's a small type of crew. They got these crew members got together, had a celebration, and one of them tested positive over the weekend. And by the end of the week, the next week, 2 people already had it as a result. And when you trace it back, you can't never be 100% sure that it is because of that social gathering, but because someone tested positive and then you have 2 or 3 people from that same group that test positive, you're going to have the investigation leads to saying, this is most likely work related. So I'm just really trying to avoid for you guys to have to get into procedures for outbreaks, because once you have an outbreak in your hands, you have to notify the health department, right? And it also kicks in your outbreak procedures per the current California mandated coronavirus prevention program. And so we'll go into that. Because this Delta variant is more infectious and spreads faster, continue to keep a very strict eye on social gatherings, celebrations, and employees getting together during breaks and lunch breaks, etc. So that's what's causing problems right now. I'm just kind of highlighting what we're seeing during this past couple months. This is the one that I told you. The New York Times came out with this article. And one of the things that called my attention is that, the Delta variant remains the cause of over 99% of cases in the country. He added, we're keeping a very close eye on this new variant. Also, the thing that he talked about is that he doesn't doubt that at some point in the future, 3 doses will be the standard number for you to be considered fully vaccinated. So more updates. Truly, talking to OSHA, they told me, these regulations or emergency standards should be updated more often. And our program, the model program that they provided to all of us, should have had more updates. But it's not getting updated as much as it should. A lot of these things are not being considered. And so what falls on us is keeping up to date and keeping an eye out, because just as much as I told you with the Delta variant, you have those issues where the CDC is recommending testing even for fully vaccinated individuals, and the emergency standard doesn't require testing for fully vaccinated. You do it because the CDC is updating their guidance constantly. So it's up to you to really keep updated and look after the safety and health of your workers. That's number one. Second, if you keep an eye out for this new variant, and also what's going on about vaccination and booster shots and the actual term of fully vaccinated, I don't doubt, like he's saying, that later on we will have some CDC report or CDC guidance stating that now for you to be considered fully vaccinated, you should have had 3 shots instead of 2. What I'm seeing a lot is signs and all types of businesses where you still have to wear a mask or masks required, but it's not enforced. So people do not wear masks while indoors. The thing is, we're still considered to be in an area of high transmission. So the entire state of California and a lot of the regions in the nation, we're still considered a high rate of transmission area, geographical area. And still, we are not getting back to enforcing the use of masks. I should have taken a picture. My local library has a sign that says, "We recommend you to wear a face mask even if you have been fully vaccinated." Now, that's a recommendation. It's a public library. But remember that in your business, in your place of employment, you have the capability to require face masks from employees, from visitors, from vendors. And what I'm trying to do here is not that I'm pro masking, pro vaccine, or against vaccination, or against wearing masks. I'm not going to get into the political issues of it. And I keep on repeating this. I am only sticking to compliance. And for issues of compliance, the reason why I advise my clients to do this, it's to get you out of trouble. When you put measures in place that added together will give you more protection and more peace of mind for your employees, you will see less problems later on of an employee complaining to OSHA, OSHA being on your job site. And one of those issues is the wearing of a mask. It has to do with the fact that because there's high rate of transmission in most counties right now, wearing a face mask indoors is the current recommendation by the CDC. Yes, it's a recommendation. Can you make it mandatory? Absolutely. That's your business. You can make it mandatory. So instead of putting a sign that says, "We recommend you wear a face mask," even if you're fully vaccinated, you should say, "We require that all visitors, employees, and clients wear a face mask while indoors due to CDC current guidance." So you can require it and cite the CDC current guidance because it's your business and you can make it a policy, an internal policy, right? Why is it going to save you from compliance issues? So inside your business, you have all sorts of employees. You have employees who are pro-vaccine, against vaccine, and not vaccine in general. Let's say that they just don't know how safe the vaccine is for COVID and they're not too sure. They haven't done their research, whatever it is. They're not too sure. You also have employees that don't want to keep wearing the mask, and they were happy when the economy opened and they got vaccinated just for the single purpose of not wearing a mask. So you requiring masks again throws a whole wrench in their thinking and they're just very upset. So the truth is, through constant communication, through trainings over and over, even if it's daily, once, and I say daily because some operations do require training to be held daily and COVID to be touched on every day. Smaller operations would require that you actually talk about this issue on a weekly basis, if possible. But that is the only way you're going to achieve compliance for your employees, because you are constantly telling them why you're doing something. If you just spring it on them and say, "You know what, wear a face mask because we are in an area of high transmission and that's just what we want here," well, they're not going to be very happy. They're going to be very upset because that's why they got vaccinated. But if instead, before you put the mandate, you hold a training session, you hold a meeting where you tell them, "Hey, there's this guidance right now. Anybody, no matter what's their vaccination status, needs to wear a face mask while indoors." And for those of you that are out doing work outdoors, delivering and working with a team member, and you get close, less than 6 feet apart to do, a coordinated lift or whatever you're doing as you're working together, I'm going to ask you to please wear a mask. And then you start asking, you start doing your communication, holding your tailgate meetings, telling them why, showing them a link for the CDC and the reasons why you're doing this. For example, I would have shown them the case of the Princetown, Massachusetts outbreak, where you had 3/4 of those people that were vaccinated and they still had a breakthrough infection, which means although they were vaccinated, they got COVID, and some of them ended up in the hospital. Of course, very little numbers, but you don't want to play, you don't want to be that person, that number that ended up in the hospital, even though you were vaccinated. And through the use of masks, we truly do slow the spread. And during this time where we have the Delta variant still circulating, we want to go back to that. And we want to go back to really asking team members to wear their face mask while indoors and outdoors if they're working close together with a team member. Of course, if they're alone indoors, no need for the mask. If they're alone outdoors, no need for the mask. If they are riding together in vehicles, there's a need for the mask, even if they're vaccinated. So this is just right now. And through training, look, it takes me a full hour to go over these things with you. And you are the supervisor, you're the managers, you are the owners. And you understand that even though you may be against all of this, because you opened up your doors and you're a business in California, you have those issues of compliance and you have to sometimes do things that you may not agree with, but you must for the good of your own business and for compliance issues, right? And of course, for those of you that are pro all of these things, you know, it's also for the good of members, public health, and the health of employees and the public. May an employer require an employee to wear a mask at work, even if the employee provides documentation verifying that they are fully vaccinated? This is where you get this information. So you get it from the covid.ca.gov. It's right there, plain as day. You can bring it on a screen and show it to people. You can put it on a handout and give it to your workers so that they wear the mask and they know that you can require it. Absolutely. So it says, yes, employers can have policies that are stricter than those required by the COVID-19 Prevention Emergency Temporary Standard. However, an accommodation must be made for those who cannot wear face coverings due to medical and mental health condition or disability, who are hearing impaired or communicating with a hearing impaired person, and when an employee performs specific tasks which cannot be performed with a face covering. So make sure that when number 3 kicks in, that you have delineated steps and input from your employee as to, and this is very key, input from your employee as how to do the job, because it's their safety. So they want to, kind of talk to you back and forth as to how should we do this so that people are not spitting on me or I'm not too close to people because I'm worried during this Delta variant going on. And so getting employee input really allows for that communication back and forth to help into the goodwill and the good faith from the employer saying, I really care for your safety, right? So accommodation, who are your experts? Your HR people. They've been doing accommodation since the Americans with Disabilities Act came into place. Make sure that they do accommodate those people that cannot be vaccinated, fully vaccinated, or cannot wear a face mask. Okay, so more on communicating with your employees. So I am really advising all of you to hold these quick sessions where you explain and clarify terms, especially if you're hearing rumors in your facilities where, well, you know what, we already know who got COVID. This is very common. We already know who got COVID. And you know what bothers me most is that they know this person has COVID. That's why they're not working right now. They sent him or her home. And I had to do the job that day with her. I actually touched the same equipment that he or she touched, and nobody told me anything. Nobody offered me testing. Nobody sent me home. And I have a baby and a newborn baby. And how do I know that I'm not taking this virus to my home and to my newborn? Those are the things you start hearing, right? So when you have these instances of people or rumors or small crews where it's very easy to identify who the sick worker is, hold these 5-minute sessions where you explain and communicate certain terms and certain issues. Number 1, privacy is number 1. You cannot reveal the identity of the person. You can also tell them to their faces, I know you know. See, but through communication, you alleviate a lot of these issues where people are unhappy, where people start working in a hostile environment, because that's what you're dealing with a lot of the times now. And remember that hostility and all of these concerns and all of these rumors and gossip and all of that becomes not just a hostile work environment, but it's just the playground for these workplace violence issues to start happening. And that's another thing that we don't have included in our emergency temporary standard, how to handle hostility and issues of workplace violence, because of the requirements in place right now during the pandemic. We don't. But it is up to us employers to take a look at what's happening and protect our workers, even if that means due to a hostile environment. So number two, explain confidentiality is top priority. Hold training sessions according to the required 10 elements of training. A lot of us have done a training because of COVID, and we're just kind of resting in a laurel saying, I already did training, I already told them, and I provided information, so that's it, right? Repeat the information. Please hold several training sessions. Go over the 10 elements over and over again as many times as you need to if you have the time. If you did a whole 1 hour training at some point in the beginning when the June 17 emergency temporary standard requirements came into being, okay, perfect. Now hold 15-minute sessions reviewing, 3 elements at a time, and just schedule them with certain regularity so that people continue to have that top of mind and concerns are expressed often enough. So I have a quick guide here for you guys. Let me see. Let me show it to you. Sample. I have a couple samples I wanted to show you. So this one, let's see. What am I doing here? Okay, so what to do when an employee, it's really interesting, but when I talk to managers and supervisors, they always bring me down from the clouds of compliance that I'm always at, because I'm always, dreaming of full compliance for all of my clients. And while I realize supervisors are always pull my feet and say, hey, lady, it's not like that. I really do not have time to read that 23-page coronavirus prevention program that you gave us. It's too lengthy and I don't care. I don't want to read it, right? Some of you are very nice and do read it, and you do put the time to read it and dissect it. For the most part, your supervisors, the people that are out there to produce and to get the deadlines going, they don't have time to read a 23-page policy. So they want a cheat sheet. So I prepare a cheat sheet for my clients, right? And so what to do? You first tell them, this is what you may encounter. You may encounter a worker that starts feeling sick at work, or who calls you with symptoms, or they call you, or they could call you with symptoms. So here it is for you, manager, what you need to know. Remember what the list of symptoms are, because what if the symptoms they're telling you have nothing to do with COVID, right? That's number one. Number two, the reason why knowing the symptoms is important is because many times they say, well, I started having symptoms Sunday at midnight. Now, what symptoms? Because remember, the high risk period is going to be 48 hours prior to the onset of symptoms. But if they had symptoms of, tingling and numbness down the arms at midnight, that has nothing to do with COVID. So you wouldn't take that high risk period 48 hours starting Sunday at midnight, but let's say Monday at 12 when they actually started having a sore throat. See, those are things that your managers want to know because they just aren't sure about those things. So what does it mean to have those symptoms? Why is it important to know the onset of symptoms? Because you need to know what the high risk period is, right? So we put in red, confidentiality, top priority, review with them why you can't say the name, although they know it. For a lot of them, they know it, that you can't say the name. There's two issues that are here also coming up quite often. One is the thing that they say, wait a minute, there's an actual notice that they sent me, a letter saying that there was a positive case at our work site. And so they're notifying all of us because we might have been exposed. But then out of all of those that got that letter, only 5 of them got to go for testing, and only 5 of those they paid for the testing and gave them time off work to go get tested. I'm so angry that they're not doing it for me. So this is our fault, you guys. This is our fault because we're not communicating why we're doing these things. And this is why the cheat sheet was prepared, because, what you need to tell them is, the regulation has a couple of requirements. And one of the requirements is that we notify people at the work site. So that could be, the vendor that just walked in that area and dropped off a couple of boxes, went out to his truck and continued delivering that day in the morning. And at that work site, at that location, at that department, there was a COVID case at some point in time. Now, he never saw, talked, or visually discussed anything with this positive case. So, or therefore, he was not identified as a close contact. And because he was not identified as a close contact, he's not being sent for testing. So, these are the types of communications that your employees who did not prepare this policy, who do not take these classes with me, do not know about. They don't know that there's a requirement for notification just because that work site had a positive case, and there's the actual requirement to exclude from work and to send out for testing to those close contacts, those identified as close contacts. And a close contact, as you all know, is those people who were in less than 6 feet distance with a positive case, confirmed COVID case, for more than 15 minutes in a period of 24 hours. And it could be cumulative, 5 minutes right now and 10 later. So these things need to be communicated. If you don't discuss them with your workers, they're upset because I got notified, but I never got sent to be tested, or I never got sent home. So upon notification, immediately contact the person in charge of the program. Many times is the HR person. And make sure that you give some sense of urgency, right? Why? Because what I'm seeing too through experience is that your workers are getting upset that the case was positive 5 days ago and they barely knew about it. And it's like, what? Because they talk amongst each other. Can you believe this? So and so, we know it's so and so, although the company's not telling us because they want to cover their butts. And so what's happening is this person is positive for COVID and they didn't tell us until today. And that's 5 days later when I probably have spread the virus all over. That's not the case. And how do you know that that's not the case? Because you've done your investigation, right? It shouldn't be your case because you've done your investigation per the actual procedures that I've been telling you about. So immediately contact HR or the person in charge of your COVID-19 prevention program. And that means put some sense of urgency into your message. If that person is not available at that moment, come up with a code phrase or something that says, hey, this is related to the health and safety of the worker, is urgent. And that includes COVID, right? It may include COVID. Something that tells the HR person, I need to get back to this manager right away, so that we can set in motion the investigation procedure, the contact tracing, the actual notification process, and the documentation as to list of close contacts, list of people that are going to get to be sent home or get tested, and when those letters are going to be notified, which is their work site that needs to be notified. Okay. So I'm not going to read the entire cheat sheet, but basically just goes through steps and make your list of close contacts. Number 4 says exclude from work the employee who's a positive case or suspect case and his or her close contacts, and following the following recommendations. And that's where for exclusion of work, the current emergency temporary standard said if they're fully vaccinated, they don't, even if they were identified as a close contact, they don't need to be exempt from work. In my case, because of the current guidance, I'm telling you, until they get tested, you should exclude them from work because of the Delta variant. So step number 4, it should be 5, I'm sorry, 4 and 5. Attend to the workers' needs. Be attentive to what they're saying, be attentive to the gossip, be attentive to the rumors, because they all come out of true concerns. People get concerned for their safety and health, not just theirs, but their family members. So whenever you hear something or you get a concern that is brought to you, tackle it immediately, talk to them about it, provide them with information about why things are being done a certain way. It's fine. You don't have anything to hide, so it's good. One of the things that I did here is I asked my managers to just hold a session, just make sure that you go over, did they provide you with benefit information? Because that's a requirement. If you got a notification, this is the reason why you got notified. And you can actually go over some of the definitions of what a close contact is, what high risk period is. And so for that purpose, since there are some terms that you're very familiar with, but your workers are not, for example, they don't know what high risk period is. Now they know. Through this whole pandemic, we've been drilling them with all of that. But let's say they don't know what a close contact is really, or they don't know why someone gets tested and why another person doesn't get tested. in my cheat sheet, I put the actual definitions. So it's 2 pages, and in the back, I put all of the definitions. I actually even put the whole definition of what COVID symptoms are, so that the person handling that case remembers, okay, well, if they're telling me these are the symptoms, I need to know for sure those are COVID symptoms, so that I can take that 48-hour period from the onset and take it back 48 hours to see who are the close contacts, right? Who is an exposed group? Talk to them. Well, that's employees at a work location, a working area, a common area of work where an employee COVID case was present at any time during the high risk exposure period. A common area of work includes bathrooms, walkways, hallways, aisles, break or eating areas, and waiting areas. But there are some exceptions that apply. You're not considered to be a part of the exposed group if you momentarily pass through while everyone was wearing face coverings without congregating, and that wouldn't be considered part of the exposed group. If the COVID-19 case was part of a distinct group of employees who are not present at the workplace at the same time as other employees, so they could be there at a different shift, so that person is not part of the exposed group, right? Another exemption is if the COVID case visited a work location, working area, common area of work for less than 15 minutes during the high risk exposure period, and the COVID case was wearing a face covering during the entire visit, then those people that he talked to for less than 50 minutes, none of them, and neither that location is considered part of the exposed group. Do you see what I mean? So these definitions become so important to clarify issues with your workers, that they really augment that good communication that goes back and forth with them. Even what a work site is, because for the purposes of notification within 1 day, the work site definition comes into place. Who gets notification? The work site. For the limited purposes of COVID-19 prevention regulation, means the building, store, facility, agricultural field, or other location where a COVID case was present during the high risk exposure period. It does not apply to building floors or other locations of the employer that a COVID case did not enter. So who gets notified? The work site. So for the limited purpose of that, is anybody in that locale or geographical area or building where the positive COVID-19 case was present. It doesn't tell you for how long. It's just, if he was there, he was present, those people get notified. Those people get notified. Now, out of those people that get notified in that work site, who is part of the exposed group? And that now it tells you the definition of exposed group. Now, out of that exposed group, who gets to be excluded from work and who gets to have testing? And then you go over that. So do you see how that is super important? That is just part of really, truly, and this is a 2-page cheat sheet with an actual back 1 page of definitions, just definitions that are included in the emergency temporary standard for purposes of clarification with your workers. All right. Any questions up until here? No? You guys are very quiet today. So improving our policy takes to go back and look at it and modifying it. But the truth is, I really don't think you're going to get severely, let me take that back. I don't think you're going to get cited for not doing all these modifications to your CPP, your coronavirus prevention program. When I say CPP, that's the term OSHA gave to the actual written program, coronavirus prevention program, because the virus and the pandemic and the guidance is changing so often. So what I want you to do is have the written program, and then whatever you're doing that is new or different, such as this cheat sheet, such as the new recommendations with fully vaccinated people and the exclusion from work until they're tested 3 to 5 days after they were exposed or considered a close contact, etc. All of those things, just have it in writing through memorandums or emails. That way, if you ever have a OSHA inspection, you might have not immediately gotten to modify your policy, but at least you have those documents that prove that you've been current. So those tailgate meetings and those 5-minute get-togethers that you do in the morning for production purposes, you're going to discuss what you're going to do for the day, how to achieve goals, whatever. You're throwing in there a little bit about COVID and some of the new guidance. That's what matters. If it's, and if it's documented, it happened. If it's not documented, it never happened. So if it's a 5-minute talk, just add to your agenda that for 2 minutes, you discuss these updates, right? Some explanation in regards to who is going to get excluded from work. or that you now have a cheat sheet, right? Whatever you're doing, make sure that you do this. Mm, sure. I'll make sure that you get a copy, Nazanin, that if you need a copy of that. Remember, you are supposed to modify that to fit your needs. Don't just take my template and think that it's going to work for everyone. You need to read it and make sure that it applies to your place of employment. How should you perform this training for the entire site? So this is how I would do it. I personally, just depends how your resources are. If you have the budget, I would ask managers and supervisors to take the time to train, because it allows for that personal communication and those concerns to be expressed. So every supervisor with his or her crew of 10 people, that's perfectly fine. Give your supervisor a guidance on how they need to train. You give them a list of the 10 elements of the training so that they go over the 10 elements and they go over a Q&A. Okay. Now, the other way to do it is record a session like this sessions that we're doing right now. I'm doing that for a couple clients where I do a COVID-19 training over Zoom. We record it and we make it available to the actual employees. We can hold it live. So there are questions during the live session. For those that you need to chase down that couldn't make it to the training, which by the way, you should have some sort of incentive program for those that do attend the training, because safety training should be made mandatory and disciplinary issues should be the actual consequence for not attending. That's up to you, but you have to do it. It's part of an effective injury and illness prevention program. So you could do it Zoom, you could do it live, but if you're going to do it live and you're tasking your supervisors to distribute this information, make sure that you give them the tools to do it, right? Either by training them as the trainers and helping them through the process, or you do it through a Zoom call and you get several trainings scheduled. I'm doing that with some of my clients too, where they have a couple of dates with me where we're doing 2 or 3 trainings and then we're reviewing it quarterly. Yeah, provide with all the training materials. Provide them with a copy of the cheat sheet and go over it so that they know what you mean by exposed group and who's going to get tested if you ever have a case. Discuss it before you have a case in your hands or an outbreak in your hands. Some people are having outbreaks because they relaxed their mandates on face coverings and on social gatherings, and people are getting together at break time, or they're getting together for some celebration that has to do with work or that has to do with a group from work, and then you have an outbreak in your hands. Are people with certain jobs required to be vaccinated? Yes, we all know that now. We have healthcare workers need to be vaccinated. Any of those workers in congregate settings like homeless shelters, etc., nursing homes, state employees, and K-12 teachers and school staff. All of them have to be vaccinated, and the only exemptions are because of conflict in religious beliefs or qualified medical reasons. These are interesting exemptions because the religious beliefs is just a statement, and the qualified medical reasons, if they've had some sort of allergies or reactions in the past, their doctor may give them an exemption as well. So if they're not fully vaccinated, they're still required to get tested for COVID regularly and wear masks or other personal protective equipment. So make sure that if you are if your place of employment is in the healthcare business or congregate settings, like the ones I mentioned, nursing homes, residential homes that care for the elderly, if you're a state employee or you have a school, etc., any of those businesses must take a look as to the requirements for regular testing of your employees for those that are not vaccinated. All right, guys. So I am open to questions. Oh, no. I actually wanted to show you, this is why I finished early, because I wanted to show you also a sample policy as you go on to improving your policy and you get to work with updating. Some of you have your injury and illness prevention program together with your COVID-19 policy. So let me show you an example of what I mean. Many of you, and this is I wanted to get to, have put together your injury and illness prevention program along with your COVID-19, and that's fine. Do I recommend it? No. Why? Because unless you're a very small employer, You want to have policies separated. One for bloodborne pathogens, one for lockout tagout, one for confined space, one for fall protection, one for everything should be separated. Here is an example derived from, by the way, OSHA just came out with new model programs. So there's a lot of new model programs out there that I highly advise you to look into, even if you have one already, because they're simpler. They're nice. This is based off of a non-hazard, hold it, non-fixed. Wait. No. Give me a second. January 2021, they gave us this new model program, and this is for a non-high hazard employer. Okay, if you don't know what a high hazard employer is, there's an actual list. Basically, those types of industry with a historically high rate of injury and illness will be considered high hazard for California OSHA. And those that are outside of that list are considered non-high hazard. So this is one document for a non-high hazard employer. Here is the model program by OSHA. I left it with even with their logo and their date when this program was provided to us. And then I just added a table of contents, right? So you put your logo and you start with your injury and illness prevention program. I love Word because, you have your table of contents and you just click on it and there it is, all the elements of your IIPP and the appendixes to your IIPP, but then you have your COVID-19 prevention program. Because this is for a small employer, put it together. When I click COVID-19 prevention program, it takes me there, right? So that's really great. But some of the things that right now you want to make sure you look into in your policy have to do with these attachments that the model program came up with. And by the way, this COVID-19 prevention program is also derived from the OSHA model program. And this is the document that has to become one of your go-to documents whenever you have a positive case in your hands. So let's say you have a person who says, you know what, I started having symptoms Sunday at midnight. And when you ask what those symptoms are, they do fall within the list of symptoms for COVID-19. Do you see how important it is for you to know what are the list of symptoms? Remember them? Okay. So you say, okay, so now we have to investigate these cases, right? You have a date of when was the suspected or confirmed case known to the employer. Name of the person conducting investigation. If that's you, that's you. Name of the COVID case, right? And the contact information. Remember, this is all confidential. So you could have a different list. If this document is something that you're going to be handling with your supervisors, etc., and you have a concern as to confidentiality, you could just put a number, a key or a code, and then have a different or separate list that is kept confidential with the names of the person and the codes, so that just the authorized person, meaning HR, for example, has access to that list of names. Occupation, why they were in the workplace. If they are not an employee, why were they in the workplace? Names of the employees and representatives involved in the investigation, the date the investigation was initiated, hopefully right away, less than 24 hours from the time you knew about this positive case, right? Locations where the COVID-19 case was present in the workplace during the high risk exposure period. So now you're going to make a list of the locations where this person was at during the high risk exposure period, which is what? 48 hours prior to onset of symptoms, and the activities being performed. Why the activities? Because remember, it really matters if they were there for less than 15 minutes and if they were wearing their face covering, right? Because you may have, remember with those definitions, if they were at any location less than 15 minutes wearing a face mask, you don't need to have that as the exposed group or a location for notification, right? What else? Here, summary determination, who may have had a close contact with a COVID-19 case during the high risk exposure period. So you get it to make a list of those who are close contacts, their vaccination status, when testing was offered, including the results and the names of those that were exempt from testing because they were fully vaccinated before the close contact and do not have symptoms. This is why this class you're taking today is so important, because now you know right here on this bullet point that you are still going to send those people to be tested, right? Why? Because it's a recommendation right now by the CDC. Right. And then remember that immunity is still taken into place, because it says you don't have to offer testing if they've had COVID already and they're within that 90-day period. That's the second bullet point here. And by the way, that continues to still stand. I believe some studies have shown that for those people that had COVID and recovered from it, they developed immunity very close to what the vaccines provide. Of course, healthcare providers are still promoting the vaccination even if you've had COVID. So it's a matter of documenting, because in this case, if an employee is saying, no, I'm not going to get vaccinated, and they've had COVID in the last 90 days and they haven't developed symptoms, you do not have to offer testing, right? So I love this form precisely for the reason that it gives you great guidance in regards to how to handle a case whenever you have a positive case in your hands. And so the last thing that I'm going to leave you with is just making sure that you do your notifications within 1 business day, right? To all employees who were in close contact and their authorized representatives. There you go. So don't dismiss these forms. They're really good forms. They're in the COVID-19 prevention program, model program from OSHA. And then the key here is making sure that you analyze those workplace conditions that may have contributed to the risk of COVID-19 exposure. So it could have been a social gathering, a celebration, and that helps you, employer, to change those things and implement policies and communicate them to your place of employment and say, hey, we had a positive case, and then we had 2 more. We have an outbreak in our hands, and that's because you guys got together to celebrate. I didn't know Department A or B had a celebration or a birthday get together going, and this is what came of that. So we're going to implement a policy right now during this Delta variant circulating that we're not going to have any social gatherings, even if everyone is wearing a face mask. So it is really up to you how you're going to change those things, because you saw that that's what caused the outbreak, or that's what caused the positive case to be present at that time. What could be done to reduce the exposure, and was the local health notified? And that would be what you need to do if you have 3 or more positive cases within a 14-day period, right? So the training roster is right there. Let me just get for you to the training elements so that you know what you're required to do. So here in my table of contents, oh, sorry. Wait, training. In my table of contents for COVID-19, I have training and instruction, and includes, and it's 10 elements. So number 1, where are your policies and procedures? Number 2, benefits. So you have to actually give them a copy of benefits or tell them that they are going to receive them the moment they are identified as a close contact, or that they need to be excluded from work, right? Because they need to know, even if I get sick, or if I have even vaccination leave, right? It's included in these types of benefits, because they need to know, hey, if I develop symptoms because of the vaccine and I have to stay home, what are the benefits that I have? This is required as part of the training. And then the fact that COVID-19 is an infectious disease. I've talked to you about these requirements before. So you just have to read them and go over them and be knowledgeable about it. Because if you're going to be doing training and you're going to be repeating this information to your workers, there is bound to be questions. Be ready for those questions. If you have any doubt, give me a call. More than happy to help. I've been receiving questions from many of you, and I am very grateful. What does it do for me? It helps me to continue getting updated and get more information to spread the word and keep everyone safe at work. So with that, I hope you have a great weekend. Lindsay, thank you so much for hosting this webinars, and I will see you guys in a month.
Yes, thank you. Thank you, Alba. Before everyone leaves, I just want to say for CEUs, if you request or would like your CEU 1 credit for these webinars, please email Ani to ask. There's just a lot of people, so she can't really do it for every webinar, but she can definitely get it to you if you can use them. And then we've also gotten feedback saying that that we haven't responded to those requests, and we've looked back and we don't see any requests that we haven't answered. So just please follow up if we didn't return a CEU certificate to you. So yeah, so just let us know if you need those. But yes, thank you everyone. We'll see you next month for the next webinar.
So basically, if you didn't receive it, just follow up with us, please. Follow up. We want to take care of you. We want to take care of you. That's our motto. I know that's Lindsay and Annie's motto. That's the motto of UCLA. So please help us out. And thanks again to all of you. And you'll receive the presentation and the materials in the next hour or so. Thank you.
Thank you, Alba. I do see someone
Kelly,
just, yeah.
right. Scholarships is revising the quarantine for people who previously had COVID. Kelly, they are revising all of the standards. They're revising everything they're supposed to provide us with updates, but they haven't. So for right now, what Cal OSHA has stays. And just go back to reviewing what the regulation says. That's what's staying right now. There are no changes. Now, if you want to follow any of the CDC guidance, you just have to make sure that it is appropriate for your setting, right? Because the CDC is very clear at separating guidance for healthcare settings and any other businesses and congregating types of settings. All right. So Angel, thank you. Angel, thank you very much too. Kelly, did that answer your question? Yes. Awesome. Thank you. Have a fantastic day, everyone.
You too. Bye, Alba. Thank you.
Thank you, Debbie. Thank you, Kelly. Thank you, everyone. Okay. Talk soon.